Hello, welcome tonight. I want to talk to you about another way of testing peripheral nerves. And this is through a process. It's a form of biopsy of the skin. It's called the epidermal nerve fiber density test. Um, so how do I best describe this to you? Well, the idea is you're going to go about 10 centimeters above the ankle and you do a biopsy of the skin and send that biopsy off. And what they do is they count the nerves in the biopsy. So these are going to be small fiber nerves. These are going to be the nerves that can be pretty significant in that they show the degeneration of nerves in peripheral neuropathy. They can also show damage that may be happening, or even the absence thereof. And so when you do an epidermal nerve fiber density test, they're going to give you one of multiple results. They may say, okay, they're completely normal nerves. They may say they're normal, but they're seeing some degeneration. So there's a normal count, but they're degenerating. They can be saying, okay, you actually don't have a normal count. You have a mild decrease, a moderate decrease, a significant decrease, or even a complete absence of the peripheral nerves. And what this tells us is that you have a small fiber sensory neuropathy. That is significant. That's a big deal, because with this epidermal nerve fiber density problem, then you're going to actually have a peripheral neuropathy that presents with small fiber disease. It may be symmetric, it may not matter. That's what typically we'll do this biopsy on both legs so that we can actually confirm that they are symmetric, that they are presenting in a similar fashion. This is the only way to truly diagnose small fiber sensory neuropathy, and it is important that it be done to rule out certain types of small fiber sensory neuropathy. Although some of the treatments that we can do can be done even if you don't do this exam. My recommendation, do the epidermal nerve fiber density test to evaluate your nerves, especially your small fiber nerves, for two reasons. One, it will give you the diagnosis, but two, it can then be used 6 months, a year later to determine if your peripheral neuropathy is getting better or getting worse, especially if you're undergoing treatment. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget day 253. Have a great night. And if you have peripheral neuropathy, there are things that can be done to both improve your peripheral neuropathy and ultimately give back your life. My goal for you is that you can reach your dreams, reach your goals, live your dream, and truly experience an extraordinary life, even with peripheral neuropathy. Thank you, and have a great rest of your night.